Heart disease, a formidable adversary claiming millions of lives globally. We often perceive it as a man's disease. This misconception is perilous. Heart disease is the leading cause of death for women, surpassing all cancers combined. Yet our understanding and approach to women's heart health lag behind. Welcome to Channel Health Alerts. Women experience heart disease differently than men. Their symptoms, risk factors, and even the anatomy of their hearts present unique challenges. This disparity stems from a complex interplay of factors, from physiological differences to societal biases. Neglecting these nuances has had dire consequences, leaving women underdiagnosed, undertreated, and vulnerable. The statistics paint a stark picture. While there have been significant strides in cardiovascular research, progress in women's heart health has been agonizingly slow. This lag translates to countless women enduring preventable suffering and premature death. The time for change is now. We must shift our perspective and recognize that a woman's heart is not simply a smaller version of a man's. It is a complex organ with its own distinct physiology and vulnerabilities. This essay delves into the intricacies of women's heart health, unraveling the misconceptions and highlighting the urgent need for tailored care. Women's hearts are, on average, smaller than men's, with narrower blood vessels. These anatomical nuances have profound implications for diagnosis and treatment. They make procedures like angioplasty, where a balloon is used to widen narrowed arteries, technically more challenging in women. Smaller blood vessels are also more susceptible to plaque buildup, a key factor in heart disease. This buildup can restrict blood flow, leading to angina, a type of chest pain, or even a heart attack. The anatomical differences extend to the heart's electrical system, which controls the heartbeat. Women tend to have different electrical properties in their hearts compared to men. This difference can influence the effectiveness of certain medications and treatments for heart rhythm disorders. Understanding these subtle yet crucial anatomical variations is paramount for accurate diagnosis and effective treatment. The classic symptoms of a heart attack, crushing chest pain radiating down the left arm, are widely recognized. However, women often present with atypical symptoms, making diagnosis difficult. While they may experience chest pain, it's often described as pressure, tightness, or a burning sensation, rather than the stereotypical crushing pain. Shortness of breath, nausea, vomiting, and back or jaw pain are other common symptoms in women. These seemingly unrelated symptoms can be easily mistaken for less serious conditions like indigestion or anxiety. This often leads to delays in seeking medical attention, increasing the risk of complications and even death. Furthermore, women may not experience any chest pain at all. Instead, they might feel a sense of overwhelming fatigue, dizziness, or lightheadedness. Recognizing these atypical symptoms is crucial for both women and healthcare providers to ensure timely diagnosis and intervention. Early detection is key to improving outcomes for women with heart disease. By understanding the full spectrum of symptoms, including those less commonly associated with heart attacks, we can empower women to advocate for themselves and seek medical attention promptly. The intricate interplay between female reproductive hormones and heart health is often overlooked. Estrogen, a hormone that plays a key role in the menstrual cycle and pregnancy, also offers some protection against heart disease in women. This protective effect diminishes after menopause, when estrogen levels naturally decline. This hormonal shift contributes to an increased risk of heart disease in postmenopausal women. Additionally, certain conditions related to female reproductive health, such as polycystic ovary syndrome, PCOS, and endometriosis, are linked to a higher risk of cardiovascular problems. PCOS, characterized by hormonal imbalances, can lead to insulin resistance, weight gain, and high cholesterol, all risk factors for heart disease. Endometriosis, a condition where uterine tissue grows outside the uterus, is associated with chronic inflammation, which can also damage blood vessels and increase heart disease risk. The connection between female reproductive health and heart health highlights the need for a holistic approach to women's health care. Integrating cardiovascular risk assessment and preventive measures into routine gynecological care could significantly improve early detection and management of heart disease in women. Women often face an uphill battle when it comes to receiving a timely and accurate diagnosis of heart disease. The misconception that heart disease primarily affects men persists, leading to unconscious bias in the medical community. This bias can manifest in various ways, from downplaying women's symptoms to attributing them to psychological stress. Studies have shown that women are less likely than men to receive appropriate diagnostic tests for heart disease, even when they present with the same symptoms. This disparity in testing can delay diagnosis and treatment, resulting in poorer outcomes. Moreover, women are less likely to be prescribed crucial medications for heart disease, such as statins to lower cholesterol and aspirin to prevent blood clots. This underprescription stems from a combination of factors, including concerns about potential side effects, a lack of awareness among healthcare providers about the benefits of these medications for women, and the historical underrepresentation of women in clinical trials. Consequently, women are missing out on the full spectrum of treatment options available to men. The consequences of misdiagnosis and inadequate treatment are far-reaching. Delayed diagnosis allows the disease to progress unchecked, increasing the risk of complications such as heart failure, stroke, and even death. The underrepresentation of women in cardiovascular research casts a long shadow over our understanding and treatment of heart disease in women. Historically, clinical trials have predominantly included men, limiting our knowledge of how drugs and therapies impact women's hearts differently. This lack of representation has resulted in a one-size-fits-all approach to treatment that often fails to address the unique needs of women. While there have been some efforts to increase female participation in research, much more needs to be done to close the gender gap in cardiovascular knowledge. The consequences of this bias are significant. Women may receive treatments that are less effective or even harmful due to the lack of data on their specific physiology. This highlights the urgent need for more inclusive research that considers the biological differences between men and women. We must advocate for greater representation of women in clinical trials and push for research that specifically focuses on women's heart health. This will pave the way for more effective, targeted treatments and ultimately save lives. Addressing the disparities in heart disease diagnosis, treatment, and research requires a multi-pronged approach. Healthcare providers need to receive ongoing education on the unique aspects of women's heart health. This includes recognizing atypical symptoms, understanding the influence of female reproductive hormones, and being aware of potential gender biases in diagnosis and treatment. Empowering women to be proactive about their heart health is equally crucial. This involves raising awareness about risk factors, promoting heart-healthy lifestyles, and encouraging women to advocate for themselves within the healthcare system. Public awareness campaigns can play a vital role in disseminating this information. Furthermore, we need to invest in research that specifically focuses on women's heart health. This includes studying the long-term effects of hormonal changes, understanding why certain conditions are more prevalent in women, and developing targeted treatments that address their unique needs. By increasing funding for research and encouraging more women to participate in clinical trials, we can bridge the knowledge gap and pave the way for more effective treatments. Heart disease is not invincible. By recognizing the unique challenges women face, we can make significant strides in prevention, diagnosis, and treatment. This requires a collective effort from healthcare providers, researchers, policymakers, and women themselves. We must move beyond the one-size-fits-all approach to healthcare and embrace a more personalized model that considers the specific needs of women. This includes recognizing that heart disease is not just a man's disease, and that women often experience it differently. Empowering women with knowledge about heart disease, its symptoms and risk factors is paramount. This empowers them to make informed decisions about their health and advocate for themselves within the healthcare system. Equally important is addressing the implicit biases that can hinder timely diagnosis and treatment. By fostering a collaborative approach that prioritizes women's heart health, we can empower women to take charge of their cardiovascular well-being and live longer, healthier lives. Please subscribe to this channel for updates on health issues and share to care for others.